So in section two, I'm gonna talk about behaviors that can contribute to faulty or bad communication. First of all, it's gonna be inattentiveness. Whenever the doctor is not listening to us, I mean, the feeling is just very bad. You feel like very awkward because like you're just talking, they wouldn't listen to you at all. Use of jargon is just very bad too. Whenever doctors, you're just not paying attention about your field. And for example, they are using very technical words and vocabulary to the point that you're gonna get lost. And whenever they are not very what is that? Like they are not that kind of person that would let you to ask them questions, and they would just actually have an approach of non-person treatment. Like they would just direct you to what to do. It's not very good. Your book actually is just talking about an example of someone who is doing like a patient who is doing a research with cancer, and the doctor and she actually diagnosed with cancer. I guess it was breast cancer or like something like that. She goes to the doctor, and the doctor was not that much understanding. Like in the beginning, the doctor was just very technical, but at the end, when it comes to treatment, they were just doing baby talk and they were just simplify everything. So they didn't have balance. It's bad. The doctor should just ask you about your field. For example, if you are a college graduated, or if you are someone who actually saying that, oh, I studied this, I know about my symptoms, I need more information, they have to actually give you that kind of information, which means that they should avoid baby talk. They shouldn't just simplify everything for you because, like, you're an adult. They can just give you some cues and you can just do your own research, just understand what's going on with your body. For example, whenever you are taking therapy, the therapist, no, most of the time, they're going to tell you about the approach that they're going to use. For example, they're going to say that, oh, I'm going to do DBT. Do you want to know more about DBT? You're going to say yes or no. If you would say yes, they're going to explain it to you. I mean, they have to explain it to you while they are just sending you the documents that are necessary for you to have a better understanding of that. If you would say no, I don't want to know, that is fine. But like there are some people out there, like myself, I always just know more about my treatment plan. The last one gonna be a stereotyping of patients. So there are like some negative narratives out there. The doctors are just saying that, oh, all patients, they are like this, they are just complaining a lot. This is not true. Yes, there are some people they're gonna complain a lot. It's just going back to their background. Maybe they are just suffering from that pain for a long time. But you as a doctor or as a therapist, this is your job to just sit here and just listen to them. This is your sole responsibility to dedicate like at least like half an hour to a person that is in front of you and needs your knowledge to just address their own problem. So a stereotyping of people is just not good, especially patient. Keep that in your mind if you want to be a healthcare provider or if you want to be a therapist. On the other hand, we as patients, we do have other responsibilities. We should just basically educate ourselves before going to a doctor. Um, for example, if you do have some symptoms, if you do have like, for example, abdominal pain, you should just, check the internet, just know about some basic symptoms of that. So this way you can just actually conceptualize and verbalize whatever you know about your symptoms in a good way, in a concise way. That could just help your doctor. In general, neurotic patients, they're gonna exaggerate their symptoms. We already talked about that. Neurotic people, they are just more negative. So basically, they're gonna just actually interpret everything in the most negative way. Same goes with anxious people. Whenever someone is anxious, they either gonna exaggerate their symptoms or they're gonna pay less attention with what's going on with their body. Patients' attitudes are just very important as well. It seems like sometimes patients they cannot understand the emphasis of their treatments. So they either gonna pay less attention to what their doctor said, or they actually believe that the doctor is wrong. Honestly, it's gonna happen a lot with me. 99% of the time, I feel like my doctor is wrong. Unless I would like doctor, like the specific doctor, and I would just trust them. And the trust gonna come to me after a long time. So I get that. If you feel like the doctor is not correct, because they are not correct most of the time, I'm not gonna lie, but like, yeah. Or whenever the patient actually feels like their concerns are being overlooked. Um, yeah, I get them. But in general, it seems like the quality of the interaction between practitioner and patient actually can perpetuate the faulty communication. For example, if a patient, they wouldn't have opportunity to give providers feedback, they feel like they are misunderstood, so they wouldn't trust the provider at all. If, for example, provider would just talk in advance, like talk advanced, like they would use a lot of jargons, patient actually feel like, again, they are misunderstood, so they wouldn't trust the provider at all. So it is good whenever, if we are a provider, it is very good that we would just give patients a very short survey and just asking for their feedback, because this way it can help us just be more effective whenever we are doing our practice. So it's just very good. Um, Use of AI or artificial intelligence, it just nowadays it's just very good, especially when it comes to healthcare providers, especially for cancers or some serious problems. Sometimes machine learning can just, analyze a giant data based on, let's say, cancer stage 1, like breast cancer, left part of the breast, stage 1. They're gonna analyze a giant data of, like, let's say 1 million people, 1 million women actually. And they're gonna understand each step of developing the cancer for that specific part of the breast. And they can just predict what comes next. So this way, the doctor, they can just make their treatment more efficient, and give the patient the treatment that is just more reliable at that point and just more required. So machine learning can help a lot. Another point is sometimes doctors, they don't have time, like, to just visit people, like visit patients. So you have to wait like 2 months, yet you do have cancer. And we all know that cancer is just spreading in our body very fast, especially nowadays. I just heard that Kate Middleton, it was Kate Middleton, yeah. She got cancer, and I was, in my goodness, it's just everywhere, and just very scary, like such a scary situation for everyone. But yeah, we can use AI and machine learning to just predict what comes next. Or if we don't have any open appointment for our patients, they can just upload their photos, their X-ray, mammogram, or whatever they are doing at that point on their portal. So this way, like the doctor, they can just check it, and based on machine learning or AI, they can just respond them very fast. Like there is no need for doctors just check them one by one, because whenever you are just uploading the pictures, machine learning can just answer that question, and just doctor just doing like one quick short overview and just tell patient what comes next or something like that. There are like so many doctors nowadays, they are using AI, which is a good news. It just helped them to be more efficient. But yeah, I hope everyone, like every doctor, could just use it. So it seems like a patient who is not satisfied with the result, they wouldn't follow treatment plan at all. So at the end of the day, we as a provider, we have to make our patients happy, because like other than that, they would just go to another doctor, which is okay, but the treatment plan not gonna get complete. So like the doctor, I mean, I personally, as a person who always want to be a perfectionist, I would just be upset if I'm doing therapy on someone and they couldn't get the result. So I should first of all change my attitude. I should just be more personable, like the person, like my patient, they should just talk to me in a simple way. I shouldn't use advanced vocabulary when it comes to my patient, and I should just keep them on my track. So this way they're gonna do the practice only with me, and eventually they're gonna get the result. It's not like I should keep them because of myself. I should just keep them because of themselves, because like patient, they comes first. Another point that we have to talk about it here, it's gonna be whenever the patient not gonna adhere or like non-adherence to the treatment plan. It seems like overall about 85% of patients, they wouldn't follow the plan at all. There are gonna be so many reasons, but first of all, it's gonna be not trusting your provider. And another reason gonna be, it's gonna definitely depending on your like the severity of your problem. If, for example, the problem would be very severe, like cancer, you're gonna follow that. But if it would be a flu or a cold, or like some sort of a small problem, you would definitely give up after 2 or 3 years. But don't do that. If your plan is like for 7 days, just follow that. If it is for 2 days, just follow that. Don't actually give up on your plan. For measuring adherence, there are like so many ways, but the point is, they are not the most reliable one. They are biased because the way we're gonna actually measure them is just based on research on indirect factors. So first of all, we have to just make more direct moves instead of like indirect moves. And so this way our estimation can be more accurate.